I do want to I do want to let you know that this presentation will be recorded for the purpose of putting it on our Quincy Public Schools website for anybody that couldn't attend tonight. My name is Jill Karanis. I am the new Director of Student Support for Quincy Public Schools, and I'm joined tonight by Brianna Keating, Catherine M., Caitlin Tebow from Bay State Community Services, as well as Ryan Lang and Alicia Paul from both Bay State and Quincy Public Schools. Our district is so appreciative of the partnership that we have with Bay State and for all the support they provide to our Quincy families, and for the new opioid trust grant that we received that you'll hear more about later on, that has allowed us 2 full-time counselors to work on substance use prevention in our schools. Tonight, you're going to learn why prevention matters, hear about some recent trends and data among our Quincy students, and learn some useful caregiver tips around substance prevention. At any point during the presentation, if you have questions, we ask that you utilize the chat. You can type your question right in there, and we will leave time at the end to answer any question that you might have. Lastly, if you're in need of translation, you can click the icon at the very bottom of your Zoom screen that says More, and then there'll be a globe for interpretation. You can click that. And tonight we do have interpretation in Mandarin, Portuguese, and Spanish. At the end of the presentation, while we're answering questions, we will ask you to also complete a very short survey just to provide us with some feedback on the presentation. That will be a QR code that you can scan, and we'll let you know when that's open. We hope you find tonight's presentation informative and helpful. I think you're going to learn some good stuff. And I'm now going to turn it over to Brianna Keating.
Thanks, Jill. Hi, everyone. Actually, I'll go to the next slide for a second. I'm Brianna Keating. I'm the Director of Public Health and Prevention at Bay State Community Services. If you're not familiar with Bay State, we're a nonprofit social service agency. Our main offices are in Quincy on 1120 Hancock Street by the Woodward School, and we offer a variety of behavioral health services, including substance use and mental health services for children, youth, families, and adults. And we'll share some links to more information on that as we go along. Just a quick overview of what we're going to cover today. So we'll talk a little bit about why substance use prevention matters. Like Jill said, we'll go over some trends and misconceptions. We'll go into tips and resources for parents, and then we'll talk about the opioid trust grant counselors and their role at Quincy Public Schools. Catherine.
All right, just to introduce myself, I'm Catherine M. I'm the Impact Quincy Program Coordinator, so I run the Impact Quincy Coalition. We're a coalition that's focused on creating healthier communities for youth, and this is open for anyone in Quincy to join. So we work towards substance use prevention, mental health, early childhood support, and healthy eating, active living initiatives. So, and we also have an Impact Quincy Youth Action Team, which is consisted of high schoolers within Quincy Public Schools, and they're working towards these public health initiatives. So just letting you know what we are working towards, and that we're coming here to provide some of the substance use education for everyone.
Okay, so just to get started, we kind of want to lay some foundation around substance use prevention and why it's so important. Really, our goal is always to prevent substance use before it starts. So to understand why prevention is important, we really need to start with an understanding of what's going on in the adolescent brain. So our brains don't fully develop until the age of 26, making the teen brain more susceptible to the negative effects of substance use. So the prefrontal cortex, this front part of our brain, is the last part of the brain to develop, and it's responsible for some really important functions. It's responsible for impulse control, decision making, planning, reasoning. And during adolescence, this is a time of really rapid and critical brain development, particularly in this area. And also this kind of leads to a lot of risk taking, and again, young people are learning impulse control, they're figuring out who they are, they're learning how to make decisions, and along with this comes that risk taking behavior. So it's really important to realize that risk taking is a healthy part of adolescence. But there's healthy risk taking and unhealthy risk taking. So we might see young people trying new things, or, another example of a healthy risk would be riding a roller coaster. And then an example of unhealthy risk taking is substance use. And it's really important that we prevent those behaviors during adolescence because of this rapid brain growth. And substance use during this period can impact that brain development and lead to negative long-term health outcomes. Understanding this is also really important for us to understand kind of what motivates young people at this time in their lives. They're really motivated by emotion, excitement, short-term reward. So when we get into prevention tips later on, we want to keep that in mind, that some of those more long-term consequences are not going to be as effective motivators for adolescents. So I mentioned that substance use in adolescence can impact the brain development and other negative long-term health outcomes. So we know that 9 in 10 people with substance use problems started using before the age of 18. And in fact, young people who start using substances, whether that's alcohol, nicotine, cannabis, if they start using before the age of 15, they're 6.5 times more likely to develop substance use disorder. And this is really, again, because of that rapid brain development. And so we say that adolescence is really the peak time when substance use disorders can start to develop. So our goal in prevention is really delay, delay, delay. And this is also why it might be okay for adults to use substances, but there really is no safe amount of substance use in adolescence.
Okay. Yeah, so just going over why youth might start using substances. So in addition to understanding the brain development that Brianna went over, it's also important to understand that it's not simply effective just to educate youth on the harms of substances, like things like stress, social peer pressure, transitions. Those are some of the things that could affect why youth may use substances. And additionally, some things that could also affect is their environment around them. So is it their like reduced access to healthcare services, education and support? So some things that are around their environment would be part of why they may start using substances. So that's just a background context of that. But with the next slide, we can explain that actually that most young people in Quincy and across the United States are not using substances. And we can see that in the data that I'll be presenting in the next slide. So this is coming from the Quincy Youth Health Survey data that the students have taken in 2024. So this was taken anonymously and voluntarily and this will kind of be done to make sure the data is accurate as possible. And we have also data cleaning processes to ensure that what we are looking at is accurate. So we find that the data here is that 89% of the high school students are not currently drinking alcohol, 94% not currently using vape products, and 98% not smoking cigarettes. So the way we use this phrasing, 89% not currently drinking alcohol versus 11% are drinking alcohol, is just for us to highlight that the majority is not using substances, this is some encouraging languages for students to hear and not feel pressure with the idea that everyone could be using it. So that's how we're phrasing things to clarify. But yes, we find that not the majority of students are using these substances. And we can see in the next slide the perception gap as well. So students believe that 32% of their classmates are using, but in actuality, 11%. And students believe that half their school is vaping, but in actuality, it's only 6% of their classmates that are vaping. So with that perception of peer pressure and belief that everyone is using, that's some of the things that might affect them from start to use it, but just we want to address that perception gap and letting them know that what is the actual data to the students. And for parents to talk to their youth, it's important to understand some of the substances that are going around in the community. So I'll just be going over some vape products, and so just to go over how do they access it and how to start the conversation around it. So there's different types of vape products. Originally, it started off as e-cigarettes, but over time, it has adapted to be more popularized with disposable, rechargeable, and using variable e-liquids with different flavoring. But the most common ones that we'll find the students using and is the most accessible will be the disposable e-cigarettes, vapes, because they're more affordable and more accessible within the community. So what they with some of these brands, they constantly are changing because originally it was big brands like Juul, Bo, or My Blue, but recently the more popular ones are found to be like Geek Bar, Raz, Craze, Views, and Breeze, but constantly it is changing. So by the time I'm saying some of these brands, it's probably new brands as well. So it's very change. The industry is constantly changing their marketing strategies to make sure that the new audiences will be able to see these products. And an example of the new products that are coming out is the nicotine pouches. More commonly, you might know them as their product names like Zyn or Velo. So these are some pouches that will be used by putting nicotine pouches between your gums. This is typically sold between concentrations between 3 to 6 milligrams, but you can also find them at higher concentrations of 9 or 12 milligrams of nicotine. So, but in comparison, you'll find that cigarettes, you'll only inhale about 2 milligrams of it with one cigarette. So this just kind of shows that these are very potent pouches being put in, and they're very accessible and affordable because they're about $5 to $6. So if there is a retail that is selling it to minors, then this is very accessible for them. And in our next slide, we see how easy is it to access some of these products. So majority of students found that accessing alcohol and vape products are easier to get comparatively to cannabis, tobacco, and prescription drug misuse. So they believe half the school believes alcohol and vape products are easy to get to. And in our next slide, we also talk about, we identified how are they accessing it. So Quincy students have been accessing substances through methods of their family or their friends that are giving it to them, or they gave someone else money to buy for them, or directly from a retailer, and other methods of like online stores and social media have been also discussed. And our Bay State team has done a study so that we can find that we found that 3 out of the 21 alcohol retailers in Quincy did not check IDs. So that is something that shows that there is some methods of students accessing these products, vapes or alcohol, through these retailers. So that is just showing the access issue.
All right, thanks, Catherine. So now we're going to get into some tips for parents and caregivers. We'll kind of talk about tips across the lifespan, because I'm not sure what ages people have kids on here, but we'll try to cover it all. So the good news is that parents are the #1 influence of their children's decisions. That's what the research shows. I know it doesn't always feel that way. I have 2 kids, and sometimes it feels that they don't listen, and they're little. So I know it just gets harder as we get older. However, this is what the research shows us, is that students do report that they care what their parents say, and it does influence their decisions. So the #1 thing that we encourage parents and caregivers to do is to talk to their kids about substances, and talk to them early and often. I have a 4 and 6-year-old. I have probably been having conversations with them about substances since they've been 2, and I'll get into what that looks like in a couple of minutes. And I know we often hear kind of this talk about, oh, you're going to have the talk, and it can be this kind of big, scary, intimidating thing. That's really not what we're talking about. We're talking about kind of open communication about what your children are seeing in their day-to-day lives, maybe what they're hearing. It's really opening that line of communication early with your children. setting clear expectations with them and making sure they really know that you are someone they can trust and come to have conversations about substances or anything else going on in their lives. And so we encourage parents to have these conversations frequently and regularly. And this can be something as simple as when you're driving to a sports game or over family dinners. There are a lot of times when you can just have little conversations. And the goal is really not to deliver a lecture. We want to really listen, ask questions. Great times to do this are when you might see something on TV, a TV show your kids are watching, or something in the media, and really asking them what their thoughts are and having that open dialogue. We'll get into some more tips around that in a minute. Another tip that we always encourage parents is really to think about your home environment and making sure it's a safe space. So, adults might use substances, and that is okay. We just need to make sure we're creating a home environment where it's safe. And so we recommend locking up or securing your alcohol, cannabis, vapes, tobacco, nicotine products, prescription drugs, and really making sure they are out of reach and secured. Today, there are a lot of products that are marketed to young people, and that, especially with cannabis, there are gummies that might not look like a drug. And so it's really important that we make sure those aren't accessible to our young people. Catherine mentioned some of the ways that students report to us that they get substances. And we know that if students can't access them at home, that does reduce the likelihood of use. We also encourage parents to monitor social media. We know that a lot of companies target young people through social media. They see teenagers in particular as future customers, especially with the understanding of substance use disorder. And if you can get someone addicted in teen years, they're a customer for life. So we know that companies target young people. They pay influencers to sell their products online. Youth can even get products directly from their social media. So it's important that parents are monitoring what their kids are seeing. And this can also, again, be a great opportunity to start that conversation with your kids, asking them what they see online and kind of helping them understand that these various industries do target them, because young people don't like that. We also encourage parents to get to know their kids' friends. I think especially as kids get older and you might not know their friends' parents as well, we recommend that parents do call up other parents if you know your kid's going to their house, and make sure you share with them kind of your rules around substances. I know that this can feel awkward and uncomfortable, but we do hear from parents that they actually appreciate these calls. So it might take you to kind of like break the ice to do that, but you'll find that other parents do appreciate that. And then lastly, we recommend that you kind of think about your own use and just any messages you might be sending. It's easy to kind of unintentionally normalize or glamorize substance use. We see a lot of messages out there around, drinking alcohol to relax and that sort of thing. So we just want to be aware of those types of messages that we might be sending to our kids. So I just wanted to briefly talk about what doesn't work in prevention. I think as parents and people who work in the community, it's really important we understand effective prevention and what's not. I won't spend too much time on this, but happy to answer more questions if anyone has them. So in the past, I know when I grew up, I received a lot of messages around very scare tactics. This is your brain on drugs. That was the message that I saw. And over the years, we've learned in prevention that scare tactics and fear-based appeals are really ineffective and can actually increase the risky behavior. So again, if we think back to that conversation we had earlier about what's going on in the adolescent brain, we know that kind of these one-time, really sensational things are not going to have long-term impact on them. Young people really need ongoing messaging over time. Also, when because of what's happening in the brain, and young people are not so motivated by those long-term consequences. So when we tell people, oh, if you smoke, you're going to get cancer, that just doesn't resonate with them right now based on what's going on in their lives and kind of what's happening in the brain. They're much more motivated by some of those short-term consequences, like if I smoke, I'm going to smell bad, or I won't play as well at my sports game on the weekend. Um, we also know that, again, because of what's happening in the teenage brain, there are a lot of youth who are attracted to risky behaviors. So when we sensationalize things like substance use, the research actually shows that for youth who are attracted to risk taking, it can actually increase their use. There are a lot of other unintended consequences, like causing more shame and stigma. So overall, we recommend focusing really on the healthy behaviors you want to see grow. We want to focus more on teaching our kids how to like make healthy decisions, how to care for their bodies, rather than focusing on kind of some of the harms. And also, you really want to be someone your kids see as trustworthy. And so, if you are sending fear-based messages that they might find out or realize are not accurate, they're not going to see you as a reliable source of information. Okay, so what should you do when talking to your kids about substances? These tips are true for kids of all ages. Again, I already mentioned, but really having that conversation early and often, avoiding criticism and keeping an open dialogue. um, you can really just mention very open-ended topics and just listen, do a lot of listening. As I said before, there's no perfect time to talk. It's just multiple ongoing conversations. Um, let's see, be open and honest. If you don't know something, that's okay. You can always come back, or you could research it with your child. You could figure it out together. Like Catherine said, especially with some of the products now, things are changing. There's a lot of stuff you might not know, and that's okay, to go back, do a little research, and come back to your child to help answer some of their questions. Um, and again, just really being open and honest, and not delivering a lecture. Those are some of our main tips. Okay, so what does this look like at every age? So we have on here some prevention tips at every age. And we have a lot of resources we'll share as well on the next, on future slides, but just to give a bit of an overview. So kids from a very young age start to notice substances, and they notice the impact it has on adults' behavior around them. And so if we don't start conversations early with our children, they're going to start making their own assumptions about what they see happening. So that's one of the reasons we really do encourage these conversations early on. But of course, we want them to be developmentally appropriate. So starting in early childhood, prevention conversations are going to look more like talking about healthy habits and decision making. Um, with my young children, I talk a lot about vitamins and medicine. And so as soon as they started taking medicine, whether it's Tylenol for a fever or anything like that, I always have that conversation with them about, medicine helps our body when we're sick. We only take medicine when our parents or our caregivers give it to us. If we take medicine when we don't need it, it can hurt our bodies and make us sick. So that really simple conversation, but helping them understand kind of the safety of it. Again, this is at this age, it's also, well, at all ages, but it's really important to make sure we're also, keeping substances out of their reach and making sure they can't access them accidentally. And then really in early childhood, starting to support that confidence and social emotional learning. A lot of the things you're already doing as parents to promote your child's healthy development, those are prevention tips. And, focusing on those things in early childhood is doing prevention. As we get into elementary school, those same sorts of things are going to continue, but you're just going to add in some more complex topics. So really starting to ask them what they're seeing and hearing at school or on TV. Again, keeping the focus on that short-term consequences, not long-term. And making sure that they understand your family rules and expectations and why it's important to you that they don't use substances. But again, a lot of this focus in kind of elementary school is on that problem solving and healthy decision making, making sure your kids have some of those really strong foundational skills. As we get into preteen and teen years, kids start seeing more substance use around them. They start seeing it in the media a lot more on TV shows, which are all great opportunities, again, to have those conversations. And really also helping your kids understand that what they see on TV and in the media is not always reality. And those aren't always the norms, although it can feel that way. So really helping them understand that and have conversations about that. Also at this time, they're going to have more opportunities to actually be faced with more challenging situations. So helping your kids be prepared for that. So talking to them about impaired driving, talking to them about, if they find themselves in a difficult situation at a party or, someone wants them to get into the car with them when they've been drinking, talking them through those situations and making sure they have an exit plan and practicing what to say in those moments. I know a lot of parents have like an emoji code where if your kid sends you a certain emoji, it means like come get me, no questions asked kind of thing. So having some of those set up with your kids so they know that they can call you in a difficult situation. And again, yeah, just practicing those refusal skills. Okay, so we're just briefly going to go over some signs of substance use and what to do if you think your child might be using substances. So on the screen here are some signs of substance use in adolescence. I do want to also note that these can also just be signs of regular adolescent behavior in teenage development. So we always say don't jump to conclusions. You know your kids best. So a lot of it is just noticing differences and changes in their normal behavior. And the best thing always to start with is to have a conversation with them. And hopefully you've laid some of that foundation in the younger years that they feel comfortable talking to you. But if you need any support, there are so many resources in Quincy. The thing that I would always recommend first is to talk to your kids, but if you need extra support, we're going to hand it over in a minute to some of the counselors at Quincy Public School, but they're a great, whether it's Alicia and Ryan, who are the opioid trust counselors, or if it's a different counselor at Quincy Public School, they're all great resources for you to connect with, and they can really help walk you through steps to take, the resources available, and provide support to both you and your child. Also here, I just want to note there are some other resources that you can reach out to as well if you need help outside of school hours. And then lastly, just some resources. This will get shared with you, but these are, we did a very brief overview of prevention tips for parents and caregivers today. So these links here go into more details. They give scripts as well about how to have conversations or how to answer tough questions, like if your child asks you about your own substance use. So I really recommend these resources as well. And now I'm going to hand it over to Ryan and Alicia.
Hello, everyone. I'm Alicia Paul. I'm one of the new school Bay State counselors here at North Quincy High School. I'm housed at North Quincy High School. Ryan Lang and I are the new Bay State counselors working in partnership with Quincy Public Schools. I'm also a local Quincy girl. I grew up in Howes Neck, and I'm an alum of actually North Quincy High School. So it's really exciting for me to be back in this community and helping the students in our school. Just to give a little background, Quincy Public Schools was awarded an opioid trust grant. This grant is focused on substance use prevention, early intervention, and increasing access to support for families and students. Through this grant, we partnered with Bay State that allows Ryan and I to be in the schools, working with all grades, K through 12. We are housed in the high schools, but we are a district-wide support that we can work across all levels. So next we'll talk about what that role really looks like in the schools. So the overall goal of the role is to increase access to support, so both within the schools and out in the community. So really build that bridge from schools to our community. We focus on prevention, early intervention, and direct student support, and we work closely with the schools, counselors in the high schools, because we are in here, so that we have more access to the high school students. But as you guys can see, we're broken down into the district. So Ryan works out of Quincy High, and he serves the schools on the 02169 district, and I serve the North Quincy High Schools district on the other side of town. With the exception of one elementary school, I have Bernazani. Since it still is a newer role, we are developing it as we kind of went along this year. And like I said, we have more access to the high school kids. So we are more involved in the high school. But as we noticed first when we started meeting with students, is that the most common substances we are seeing are nicotine vapes. And most of the students that we've worked with or encountered or met with have started using those substances prior to high school. So the goal for the next upcoming year is to really get us into the middle schools as well, and just really start an earlier prevention. We do individual works with students right now at the high school level, in all levels. Actually, if a school and elementary family needs help, we actually go out to the schools there too as well, and the middle schools if needed. And then I'm going to hand it over to Ryan, who's kind of going to go more over some of this trainings and educational piece.
Thank you, Alicia. Like she said, I'm Ryan Lang, and I'm not a local guy like Alicia, but I was able to work in the schools last year and saw a lot. So finally realized to pronounce Quincy, it's Quincy, not Quincy. So figured that one out. So I feel like I'm slowly getting there. So yeah, I'm talking a little bit about the services we provide. I guess the biggest theme of our role is that we're just an extra layer of support for our buildings, for the schools we work with. We've found that one of the strongest protective factors against substance use is feeling connected to the school. So that's really why we're in the building, is develop relationships with students, with families. So yeah, we're going to provide a lot of individual counseling. We each work with students on a weekly or bi-weekly basis. And not only are we going to talk about substances, but we're really going to make sure that everything in their life is talked about and discussed. So academic, social emotional support, anxiety, behavioral supports. We work with students through that. We were lucky to be trained in a few curriculums with our partnership with Bay State, and I'll get into a little bit more of those in the next slide. But yeah, we're really collaborating with all the staff, the wellness team, attendance. If students are having trouble getting to school, we've gone out with attendance officers to the homes to collaborate with students and families on making sure that they're given the proper referrals. That's another part of our role. Is our title is school and community-based counselor, because we're trying to bridge the gap, not only supporting them in the school, making sure they have access to the proper recovery resources outside of the school and the families as well. So not only are we working with students individually and families individually, but we're running groups, co-leading groups based on healthy decision making. And we're also getting into 9th grade and 10th grade classes, doing some education on the healthy decision making. And like Alicia said, one of the things we found is that students are starting to use in middle school. So next year we're going to start getting in routinely to the middle schools on a 3 to 4 week basis to do some of the curriculum. Because we just want students to know, like Brianna said, that it's not just like a one-time meeting or one-time lesson, that we're going to consistently be talking about this stuff, and hopefully educating them on making healthier choices. So yeah, the next slide. These are some of the curriculums we were trained in. So Catch My Breath is a preventative curriculum that sort of just discusses a little more than just education, but reasons for use and the media influences that Brianna and Catherine talked about. And the results of that have been about 50% of students who would try an e-cigarette this year are prevented through this curriculum. The middle one is an evidence-based curriculum for intervention. So students that we identify have used before or have gotten in trouble at school on a weekly basis for 4 sessions. We'll meet with them to discuss like triggers of theirs and some coping strategies and hopefully establish some healthy alternatives. The goal of that is not to like force them to quit, like Brianna said, or lecture them, but more just working with them about discovering what their use patterns are, and just being another layer of support for them in a non-judgmental way towards pursuing some healthier goals. I've run the curriculum with some students, and it's received a lot of positive feedback, just so students know that we can actually talk about these things in a school setting, and they're not going to get in trouble from it. The last curriculum is a group curriculum called Not on Tobacco, and that is a voluntary program for students who are ready to quit. We have not run this yet, but we are hoping to run that in the future, just so that students know it's really hard to quit on your own. So for students that use, the worst thing they can do is isolate themselves. So we want to make sure they have a team around them, and that can include other students who are kind of going through that process because it's really hard to stop an addiction without that support system in place. So if we go to the next slide here, this is just kind of how we identify students to work with. So because Alicia and I both worked at the schools last year, we have a good rapport with all the counselors, the deans, the administration teams. So we're attending weekly meetings when we talk about specific students. And if substance use or maybe a factor that could lead to substance use comes up, that's when we'll step in and make sure that the student knows that we're a resource for them and we can get that referral started. So we have a referral form that counselors and deans fill out. We also get emails or calls from parents, either through the student's counselor, and they refer them to us or directly. And another reason we wanted to have this is just since this is the first year of our role, we want to make sure our image is out there and that people know that we're a resource. So all the administration at the middle schools and elementary schools already know about us, but we want to make sure the parents also know so that they can feel free to contact us at any time. My number and email is down there, and Alicia's is as well. So if you're going through something with your student and want to reach out to us, feel free to call us or email us. We're very quick to respond. Yeah.
Awesome. I think
yeah, Brianna.
yeah, I think this is our last slide. Jill's gonna check the questions, but we would really appreciate it if you could take a minute to check this QR code and take this very brief feedback survey. It'll give us input on how today went and also topics for future parent academies. I think we can also put the link in the chat potentially.
Great. Thank you so much to all of our panelists, our Bay State panelists in Quincy Public Schools. I hope to our parents that you got a lot of useful, good, relevant information tonight. I know that in the slides, there were some links to resources. If you feel that you did want further information, you could contact me at any point as Director of Student Support, and I could connect you to any one of our Bay State panelists or to Alicia and Ryan. You could also reach out to Alicia and Ryan right on your own. We are really making a push to, like they said, make sure that we're servicing all students in Quincy at the Tier 1 level in middle school, to do partner with our health education teachers, to do some of this preventative education and health classes. But on the, the Tier 3 level, the more individualized level, we're happy to work with your student or you as a family if there's anything that we can do to provide that support. So if I'm looking at the chat and I don't see any questions, I do see two that I'm sorry, it looks like they're written in Chinese, so I don't know if our translator has access to the chat. I would like to answer those questions, but I would wait on pause just to see if the translator is able to read those. In the meantime, if you wouldn't mind taking that brief survey that Brianna put the QR code up, we would greatly appreciate it. Just helps us get your feedback to, better our presentations, make sure that we're giving you what you need for future presentations. Just looking to see if we have anything else there. So I'm sorry, I'm not hearing from an interpreter, so I don't know if I can answer those two questions in the chat. I'm just giving it a second to see if a message pops up. So with that being said, if there are no questions that need to be answered in the chat, again, we thank you so much for joining us. We hope you found it informative. Please reach out if you need any support for you or your student or your family, or just some more clarification on some of the information that was given tonight. We'd be happy to address it with you. This will also be on our website if you need to revisit the presentation at any time. So thank you all very much. Have a great night.